This Saturday, the DEA and Northwestern Medicine will collect tablets, capsules, patches, and other solid forms of prescription drugs at 8 drive-up collection sites throughout the Chicago area. It's all a part of the National Prescription Drug Take-Back Day. So joining me now with more about why this event is so important is Sterling Elliott, a clinical pharmacist at Northwestern, and Luis Agostini, Public Information Officer at Drug Enforcement Administration, Chicago Field Division. Thank you so much for being here with us, both of you.
Good morning. Thanks for having us, Anita.
I think it's an important discussion. First, just give us an overview about what this Drug Take-Back Day is all about.
Sure. So Saturday, like you mentioned, from 10 a.m. to 2 p.m., we're hosting National Prescription Drug Take-Back Day with our law enforcement partners and those in the healthcare space, really giving the public a chance to safely dispose of unneeded, expired, or unwanted medications. So that's everything from painkillers that you may have received after a root canal surgery or knee surgery, or other medications that you don't need. Along with Northwestern Medicine, we have a host of other partners throughout the Chicagoland area that are hosting drop-off locations to safely dispose of these meds. Studies have shown that a majority of people who misuse prescription medications started from a medication that they received from a friend or family member. So it's just one more tool and one method to help the public avoid substance abuse issues.
Yeah, and we can use all of the tools in the toolbox we can get. Sterling, are there any types of medications or prescription drugs that would not be able to be accepted for an event like this?
I think, Luis, if I remember correctly, we're not taking liquids, correct? And we don't want to have needles. Is that correct?
We're taking liquids as long as they are in sealed containers. We are not taking syringes, sharp objects, or illicit drugs. So take that somewhere else to your local law enforcement if you come across. But yes, the only items we are not accepting are sharp objects, syringes, and illicit drugs.
Yeah, so let's talk about Narcan specifically, because that seems to be a growing part of the conversation in terms of what people may need access to and how readily accessible it could be. Why is that an important part of the discussion right now?
Well, I'll tell you, Anita, I think that it's maybe one of the most important public health developments we're going to see in a while. And the reason is that that's really our best tool to have at hand when we have folks that are having issues with overdoses from opioids. It's, for all intents and purposes, it's the antidote. And when we have it, we can save a life and give somebody a second chance.
And that's such a simple statement, but it means so much. Talk about the impact of events like this.
I think anytime you do something like this, you send the message to the public that the key to solving this problem is to find solutions from all different angles. And to me, that's, I think, one of the best parts about what we're going to do this coming Saturday. When you really think about it, we're going to try to address the problem from a number of different important angles. It's important to make sure that we have the tool in people's hands that can save a life, and that we teach them how to use it properly. And at the same time, we've got to do what we can to prevent people from getting started down the path. And the Take Back Day component is an incredibly important part. As Luis told us, a number of people get started down this path of despair when they first start out with prescription drugs. It may be your own, and at times there are people that are taking prescription drugs in other people's homes.
Yeah.
And so this is an important way to solve that component.
Well, I want to let everybody know that you can find a location finder. It's available at www.deatakeback.com for an easy reference to resources, nearby collection sites. Thank you both for what you are doing, and I certainly hope that it's successful.
Thank you, Anita.
Take care.
Thanks, Anita.